Hey, Dr. Nowinski, it's Brian over at the Transfer Center. Hey, the doctor calling from Carlisle Regional Medical Center. They have a patient of ours. He has a lung transplant.
Surgeon, vascular surgeon at Nazareth ER. He would like to speak to a vascular surgeon here at Temple about the transplant.
On the line from Chestnut Hill. He's calling regarding a patient in their ICU with acute shortness of breath and pancreatitis.
T3 is the Temple transport team. We're the ambulance transport division of the health system.
I've got a doctor who's at Brandywine ICU that wants to talk to you.
We're a mobile intensive care unit.
We developed the Temple Transport Team back in 2002 to provide a service to bring patients to Temple. If you're at a community hospital and they need higher level of care, we are the team that goes out to get the patient and bring them to Temple for their leading edge care.
Temple Transport is really a key component of the Temple University Health System. The ability to have patients transferred expeditiously into a referral center like we have is critically important.
The Temple Transport Team really becomes the backbone that coordinates that patient's arrival to us here at Temple. They really become and have become such an important member of the team.
So a natural progression for our ground division was to have flight division capability to move some of these patients from further out. And we cover all of the state of Delaware, all of the state of New Jersey, Maryland, into the Washington, D.C. area. We staff on our aircraft pilot, nurse, critical care nurse, and a critical care paramedic.
We have a world-renowned cardiac program and pulmonary program, unlike anywhere that I know of, especially locally. So we have the ability as a team to get those patients to Temple and to have a positive outcome.
I had idiopathic pulmonary fibrosis. They felt like I needed to be at Temple, I needed to be put on life support. So they called an ambulance from Temple. It was a critical care ambulance, quite snazzy. The paramedics, they were extremely attentive and yet at the same time extremely efficient. I knew that I was in very good hands from the minute they came. They literally, along with everybody else at Temple, saved my life.
I'm going to put some oxygen on.
We can provide a level of clinical care far beyond the average paramedic transport team.
The transport team really works together with the referring doctor and the receiving doctor at Temple to make sure that the whole transfer process goes well. And it's a real unique resource that we have that's critical to our mission.
In the comm center for T3, our mission support coordinators field about 150,000 calls per year. We transport over 600 patients by ground per month and approximately 30 patients by air every month. And since our inception in 2002, we've done about 70,000 patient transports by T3.
The support of the Temple Transport Team will allow us to acquire the advanced technologies and also to provide the training so that our transport team does the best possible job.
Every second, every minute, every hour that a patient has from community hospital to Temple counts. And to be able to transmit a picture of our patient's condition to our physicians at Temple prior to getting there would really improve patient outcomes dramatically.
They got me into the ambulance and I remember I was gazing through the back window at my husband because I was afraid I wouldn't see him again. This is the front line. This is where people make the difference between life and death. It really is critical care in motion. I don't think any of the wonderful things that happened to me at Temple would have were it not for this team.